What is going on with melatonin? It's a question so many people are asking today after many people saw a new study that has us wide awake wanting some answers about whether it could be doing more harm than good to use melatonin to go to sleep, and especially when it comes to long-term use. So I want to bring in a doctor with the American Heart Association who's also with Rush to talk more about what we're seeing and where we go from here. Thank you, Dr. Okwuosa.
Yes, hi. Nice to meet you.
Nice to meet you as well. Did I pronounce your name correctly?
Not bad. Okwuosa.
Okwuosa.
Yes.
Okay. Thank you so much. I appreciate it. And I wanted to at least try to get that right. So I'm sure you saw the study. What was your initial reaction to it?
I think my initial reaction is that and I think the authors did a good job of noting this, is that we have to be careful when we're interpreting studies, right? So when we're trying to look for example, at a medication like melatonin, we have to make sure that it's not just association between two points, right? So there's melatonin associated with heart failure, but we have to ask ourselves, does that mean causation? In other words, are we saying that melatonin is actually causing heart failure? Or are there some other factors in between that might explain what we're seeing? And this is an association study, it's not a causation study. So we know that patients that are taken based on this study, and again, it's an abstract, it's not the actual study. I haven't looked at the statistical methods for this particular study. It's just an abstract. In other words, it's like the preliminary findings that we're seeing in this study. And the preliminary findings are basically showing that it's an association. The question is, does that mean causation? And that's my first reaction. And in order for us to know whether it's causation, we have to do randomized controlled trials that would actually give certain patients the medication, certain patients not on the medication, and then evaluate what the outcomes might be based on that.
So similar to what we saw with the Tylenol conversation that took place not too long ago, that issue of causation comes back to the forefront yet again. What do you think people should be doing right now after hearing this?
I think it's a matter of interpretation. Well, for one thing, I know that we need more studies in order to know exactly what we're doing and if this is an issue. I think that when people have issues with insomnia, which, that's what melatonin is basically used for, people have to ask themselves, should I see somebody to help me figure out my sleep habits or sleep findings? I will mention that there have been studies that have looked at melatonin in the past and associations with cardiovascular diseases. And those studies have actually, they're smaller studies, they're not as big as this one. But those studies, some of them have actually shown some benefit with melatonin when it comes to risk of heart attacks, risks of strokes, that sort of thing. Again, these are small studies. And the animal studies that have looked at melatonin and cardiovascular disease have actually shown benefits. Those that have looked at heart failure have been equivocal. So again, I think this is one of those things that we have to interpret with a grain of salt. It doesn't necessarily mean that melatonin is going to cause a problem. My advice to people would be, if you have to take melatonin short term, it seems to be reasonably safe. If you get to the point where you need it long term, then I think you really need to have a conversation with a sleep specialist or a behavioral counselor to figure out other ways that you might be able to adjust your sleep habits to help you sleep better.
Yeah. What's short term versus long term, in your opinion, when it comes to this? Like a week or two or a year or two?
Yes, so a week or two, a few months, there have been studies that have looked, again, small studies that have looked at this that show some level of either benefit or at least no harm from a cardiac standpoint. But this particular study, the one that we were referring to, has looked at melatonin. They looked at it for 1 year and beyond. And so if it gets to a point where it's taking a few months, a year, that sort of thing, you probably need to speak with a specialist to make sure that there's nothing else going on. I will mention, and I will point out, that sleep itself, lack of sleep, I should say, when somebody has sleep disturbance, that itself has been shown to be associated with significant risks of cardiovascular disease. So people that don't sleep well have higher risks of heart attacks, strokes, heart failure, problems with obesity, diabetes, high cholesterol, problems with non-concentration, Alzheimer's, even death, and so on and so forth. And so it's important to remember that sleep by itself, lack of sleep, causes its problems. And so there is this concern of confounding. Is it that melatonin is leading to heart failure, or is it that those that don't sleep enough or have lack of sleep or have sleep disturbances are those taking melatonin, which is then really leading to these abnormal findings that we're finding. So again, a lot still needs to be teased out about it.
Yeah, and I guess, here we are yet again looking at supplements and calling them into question. I know that they're not regulated to the same extent of other medications. How do you flesh that out? I mean, what are your thoughts on, do you think that there needs to be more regulation when it comes to supplements?
That's a tough question. I think that certain supplements probably need regulations. Certain supplements have not been shown to be harmful or toxic. It probably is not. As long as it's not harmful, hasn't been shown to be harmful, it probably shouldn't be a big deal for people to pick them up over the counter. I think that in all honesty, I think the pharmaceutical companies they sponsor a lot of studies and fund a lot of studies and clinical trials out there. So we understand a lot of our medications that are produced by pharmaceutical companies that we use, that we prescribe or we write prescriptions for. But for those over-the-counter drugs or supplements that we don't write prescriptions for, we need more studies. We need to be able to figure out ways or have ways, either governmental ways or not-for-profit ways or other methodologies or mechanisms for funding these other studies so that we can understand a lot more about supplements that are out there. And then that way it's better, we know better how to advise patients on use of those supplements.
Yeah, what do you say to people who say, what can we trust anymore? Because it feels like something gets recalled or called into great question every week.
What I would always say is consult with your doctor, right? I think generally speaking, for those of us that go to medical school, we do study pharmaceutical mechanisms, and there's certain things about certain drugs that we can, even if we don't know the particular drug, just looking at the ingredients, we might be able to surmise and have better advice for a patient about use of those drugs. We also have our pharmaceutical colleagues, right? The pharmacy staff or PharmDs that have been to pharmacy school that understand a whole lot more about these drugs. And for most clinics, we have pharmacy staff that work with us. And we always can also lean on them and ask them questions and obtain their insight on some of these medications. And so my advice to patients is, don't hesitate to ask your doctor. If you have questions these days with MyChart, electronic records, or just call your office and just say, I want to ask my doctor about this particular drug. Don't just do Dr. Google, because there's all sorts of information. We talk about fake news all the time. So I think it's really important that you have a conversation with your doctor before starting any supplement.
And because you are a cardiologist at Rush and you're on the American Heart Association board of directors, I would like you, while we have people here, just to kind of go over knowing our numbers and when there could be an issue where we need to go see the doctor.
Yeah, so knowing your numbers refers to, we're talking about cardiovascular risk factors, right? So hypertension or high blood pressure increases the risk of heart attacks and strokes. So does high cholesterol, so does diabetes, and so on, knowing things like your family history and so on. And of course, your obesity, right? So knowing about your BMI. So knowing the normal values for these is particularly important. And having this information at your fingertips when you go to see your doctor so that you can have reasonable conversations with your doctor about them is especially important. And that way we can continue to work on reducing the risk of heart attacks and stroke within our community, which of course leads to death. Heart disease is the number one cause of death in the United States, and we all know this. So it's really important that we do whatever we can to control those risks.
Yeah.
And when we talk about the numbers, I don't know if you want me to talk about the normal numbers that people should think about. Okay, so if we're talking about blood pressure, normal blood pressure should be somewhere about 120/80, give or take. The blood pressure guidelines have changed recently, but still about 120/80 is what we think is normal. So if your blood pressures are typically higher than that, you need to have a conversation with your doctor about it. Cholesterol, we usually will calculate your 10-year risk of having a heart attack and stroke based on your cholesterol. And then we use that to make a determination on whether you should be on a cholesterol medication or not. And then in terms of diabetes, hemoglobin A1C between 5.7 and 6.5 is what is considered prediabetes. That's a warning sign. If you have prediabetes, then you need to have a conversation with your doctor, work on losing weight, work on exercise, work on eating a healthy diet in order to bring it down and avoid diabetes. Hemoglobin A1C of 6.5 and above is considered diabetes. And then your BMI, the body mass index, above 30 is considered obese, between 25 and 29.9 is what's considered overweight. And all of these, once you start getting close or inching close to the red zones, then it's important to have a conversation with your doctor, work on diet, work on exercise, lose weight, and eat healthy in order to maintain a healthy set of lifestyle and habits and reduce your risk of heart attacks and strokes.
Yeah, I remember though my hemoglobin numbers rising when I wasn't getting good sleep. So it all kind of goes in a cyclical format here. So if people are looking at this study, and they're thinking, should I just throw away the melatonin I have? You're not at that point yet.
No, I would not say that. I would not say that. I think have a conversation with your doctor is important. Again, this is an association study. We know that there is some link, but again, there could be that confounding. It could just be that those that are melatonin are those that are higher stress, those that are not sleeping well, and therefore, just because they're not sleeping well, they're at higher risk for having cardiovascular disease and heart failure. So, going back to what you talked about earlier, Life's Essential 8 is one of the modalities that American Heart Association is using to control cardiovascular risk. Life Essential 8 refers to all of these cardiovascular risk factors, and sleep was added to those set of cardiovascular risk factors that we talked about that needs to be controlled in order to reduce that risk of heart attack and stroke. And so sleep is important, and melatonin, this melatonin story is a story to be continued. We need more studies to further assess it, and it could just be that sleep is the issue rather than melatonin. But again, a lot needs to be understood. We need more trials, we need more studies, and we need more specifically randomized controlled trial in order to understand this link between melatonin and heart disease.